We're back here to the Neil Haley Show, and I'm so excited this show is going to be amazing. A special simulcast, the Neil Haley Show and celebrity dentists, and I'm excited first to welcome my host, Rivka Markel. Rika, thanks for stopping by, and how are you?
I'm doing great, and I'm very excited about this episode that we're going to start all about dentistry. So I'm excited.
All right, so who's our guest?
Are you talking to me?
Well, our guest today is, yes, you are our guest. So our guest today is Dr. Robert Fromm, and Dr. Robert Fromm is practicing dentistry for 40 years now. So he knows a little bit about it. I think he did it a couple of times. And so the last couple of years, no, I think the last 5 years, he is the main dentist in Westside Family Dental, the Westside Family Dental Group in Manhattan. So welcome to the show, Dr. Fromm. How are
Thank you
you?
so much for having me.
Okay, Dr. Fromm, we would love to know what were you thinking when you wanted to become a dentist? Where did that come from?
Where did that come from? Well, I have to explain that I did not have a great dental experience when I was young. It was old-time dentistry. My dentist did not use anesthetic. And so part of that was kind of trying to give back a better experience to people. Originally, though, I wanted to be an orthodontist because I liked my orthodontist. But then when I got into dental school, I found that I liked the restorative part better. So right after dental school, I went right into private practice and been practicing now 40 years. Yeah, long
Wonderful.
time.
So what
Yeah, you already.
aspect? Yeah, I'm. So
Go
what
ahead.
aspect of your work are you the most passionate about?
Well, when people come in, the first thing you notice about people is their smile. And when people are self-conscious about their smile, it affects their whole attitude. So restoring their look and their feel gives them such a great sense of confidence. And the fact that I can do that and I have the skill and ability to do that is fantastic. When you do full mouth reconstruction and give people their bite back and their smile and their function, it's really great. Of course, taking people out of pain is just that's great. That's an everyday kind of thing. But when you can make people feel good about themselves, that's just a legacy that will just last beyond my years of practice. That's a great gift I can give somebody. It
Yeah,
really
that is
is.
wonderful. That is wonderful. And again, like I think there is you touched on it already. There is a difference between taking people out of pain, like an emergency, something that's really urgent, and giving people like a beautiful new smile. And so we'll talk about that a little bit more. But first of all, what are some of the misconceptions that people have about dentistry, Dr. Fromm?
Well, their misconception is that everything's going to hurt and that everything's going to be terribly expensive and they can't afford the work and things like that. People have a great sense of fear when it comes to the dentist. I mean, the number one fear, obviously, is the sound of the drill, and that's gotten quieter over time. But the misconception they have is that everything's going to be painful and they're going to be scared and then they're not going to know what to do. So the thing you really have to do is get the patient in, talk to them, and really explain everything. Knowledge is power. So if you're going in, just make sure you're going to someone who will explain to you and sit down and have patience. So the misconception is that they won't know what's going on. It's a horribly painful procedure, which is really not the case. Not anymore.
Got it.
Are
Yeah.
there recent innovations in dental care that you're excited about?
Well, I think the changes in dentistry happen slowly over a period. It's like the era. The best thing that's happened in dentistry, bar none, is implants. Implants has given people, they remove dentures from their mouth now. They don't have to wear dentures. They can have a full bite. They can be comfortable. We can do things we couldn't do before. Of course, with advances in computer technology, and we'll talk about that later, how AI is going to affect us. But that will be the next big change. That will be the next big change coming, computer dentistry and computer diagnosis. But right now, the biggest change that's ever happened, implants. Wonderful things you can do with
Yeah.
implants.
That is true.
Yeah.
So I think celebrities usually they set a trend, and Neil is talking to a lot of celebrities on his celebrity podcast. So
Oh yeah.
what are the trends that you see celebrities do, Dr. Fromm?
Well, it's so funny. Celebrities always try the latest innovations. First, there was charcoal toothpaste, and then there was whitening. Then there's, of course, there's a lot of cosmetic work around teeth. There's lip augmentation. That's usually a very big thing. But people also like to have very white teeth, which is suddenly celebrities will have that kind of bright white teeth, which is a good and bad thing because people come in and they expect to have this. They bring me pictures of celebrities and say, please make me look like this, which is not realistic in real life because people don't need, Hollywood white. We call it Hollywood white smiles. It doesn't
Yeah,
look natural. It doesn't look so. The trends are there, but that doesn't always mean we have to follow them because it won't look natural. It's just not going to look good to the average person. It's going to look.
got it.
It's going to look too
Yeah,
white.
yeah. It's like
That
having
makes
your hair done and you want to have it look like a celebrity, and then you
It's
come out and
too
then you
much.
make it look, and then you wash it yourself and it looks like completely different. It's like a simple
Natural is the
story.
key.
Yeah,
Natural
yeah,
is the
for
key. And when
sure.
you do that, you want to look at the patient's face. You want to look at their shape. You want to look at their coloring. Yeah, there are a whole bunch of factors you use when you're designing a smile,
Got
not
it.
just chiclets. You want it to look natural.
all right.
That's
Could you
it.
share your recommended daily dental care routine for maintaining a healthy smile?
Oh, sure. Absolutely. I mean, at a minimum, people should brush twice a day.
Mhm.
It would be nice if you brushed after lunch too, After lunch, I tend to floss because I don't want food in my teeth when I'm talking to patients. So I get up in the morning, I'll have my coffee or breakfast, whatever, then I'll brush. Maybe I'll use a mouth rinse, a fluoride mouth rinse. I think that's always a good way to start the day. I also use a tongue scraper because that can lead to bad breath. And believe it or not, overnight plaque forms on your tongue. So I use a tongue scraper in the morning, and my breath, I'm around patients all day. I can't have bad breath. And then at night, I brush and I floss. Whether you brush first or floss first, it doesn't matter. But it's really important to brush and floss. Flossing especially, because you don't want the food collected during the day to stay overnight in your teeth. It creates all kinds of sulfur dioxide smells, which is that rotten egg smell, which gives you bad breath.
Mhm.
Yeah.
So that's really important.
Nobody wants
Flossing,
that.
brushing. Nobody wants that. Nobody wants
Nobody
it.
wants that. No, and
No.
that's the
Flossing
I
is
think,
key.
yeah, that's the routine. So, and then on top of that, how often do you feel like people should visit a dental office?
Well, if you're in good dental health, and that means minimal pocketing around your gums, and you take care and you have good dental home hygiene, I recommend every 6 months. But because if you're going to have some kind of a problem, 6 months is a time when it will probably develop. If you have a little cavity and you don't want to do it yet, 6 months is a good time to take another look at it again. However, most patients that we have in for 3 or 4 months have dental problems with their gums and their bones. And those people you really, really want to keep on top of. Some people just have more acidic saliva. Some people are just more prone to gum disease. It's a very hereditary kind of thing. So oftentimes we'll recommend people with gum problems or continuing issues to be in every 3 or 4 months. That's a decision we have to make. Standard is 6 months, but we make exceptions for 3 and 4 months with people with issues.
Got it.
All right. So that's really interesting. And a lot of people, depending on how much they really put in the time, that's important. What advice do you
Yeah.
have for people who are anxious about visiting the dentist? Because some people are really, they don't
Yeah.
want to hear the thing, oh, we're going to have to see you back in a week or 2 weeks. That's their scare. That scares people. And also just the whole scraping and how long you're going to be there. It's not always the most fun trip.
Well, dentistry is one of those things because I understand that completely because dentistry is one of those invasive procedures. You're actually working inside someone's face. So not only can you not see what's going on, but it's a very intimate kind of procedure. So I believe that I show people everything. I show them my notes, I show them the x-rays, and I give them a mirror and I show what's going on inside. And because most people, I'd say 90% of people don't know what's going on inside their mouths. So knowledge is everything. Explain everything. Explain that they have to come back, and it will prevent further problems. That's it. Just keep talking to them, talking to them. And I happen to be especially good with nervous patients because I was a nervous patient and I did not like going to the dentist. So I understand that. Patience, understanding, and compassion. That's what you need.
Yeah, for sure. So
Yeah.
once people get into the practice, once they come in, how does a day look like? Like what is the day of a dentist?
Well,
How would you describe that?
it starts the day before. The day of a
Ah,
dentist starts. I always look at the day, the next day to see who's coming in and should I be prepared if all the lab cases are in and things like that. Because you can't have a patient come in and say, I'm sorry, the lab case is not in. So you make sure the day before everything's ready. Then when I come in, after I have my coffee, I'll review all the patient's treatment. I'll go over what's going in for the day. So I'm prepared. And then I go through all the hygiene patients and I look at all their past treatments, what we might have suggested to do. And so they'll say, well, I'll wait. Maybe I'll do a night guard next time. And you look
Yeah.
at their proposed treatment plan that you've made, and some people are just not ready for it. And so you go over it again, reinforce that they might need a night guard or a root canal or a crown. And constant reinforcement is what you need. So review everything and then you start your day.
If you could choose any celebrity to walk into your clinic for a dental checkup, who would it be and why?
Who would it be? That's a tough one. Everyone wants to say the most beautiful woman or the most handsome man. I would like Obama. I think President Obama would be a hoot. He has nice teeth. I think he'd be really interesting, to talk to him. He has a great sense of humor. He's a very intelligent man. Second would be Brad Pitt. I admit it. Okay, man crush. I
that
love
is
to have
so
Brad Pitt in
funny.
there. I
From
see just how
President
good looking
Obama
this
to
guy
Brad
is.
Pitt.
Yeah.
Okay,
All
wow.
right. That's a very diverse difference for sure.
Well, yeah.
Yeah, for sure, for sure,
No
for sure.
doubt. No doubt.
So, like, when you would not practice dentistry, Dr. Fromm, what would you do?
Yes.
And I know the
Oh,
answer, I think.
oh my God. I have so many things I'd like to do. Originally I wanted to be an actor. So I would go
Exactly.
back.
That's
In
what I
fact,
knew.
I'm taking a comedy class now because I'd like to go on stage. I play guitar. I'd like to get really good at that. Bike more, exercise generally. And I'd like to learn how to throw clay because I've always wanted to do pottery because I'm good with my hands. And that takes something, that's something I can do forever. So I have a lot of interests outside of dentistry. I don't think I'd be bored,
That's
writing,
wonderful.
uh,
That's great.
exercising. Yeah, there's a
That's
lot of stuff I'd
wonderful.
like to do. I
Really
don't have
wonderful.
time to do all the stuff I'd
No,
like to do.
no, but at one point you will. But you
Yeah,
love practicing dentistry, so you won't have that the ability to do that.
exactly.
Yeah.
But I'd like
Where
to
do you?
also teach. I'd like to
Okay.
teach at NYU.
Mhm.
Give people the experience that I've had because a lot of dentistry, the advantage of being me is that I've been practicing for so long. So I see how things turn out.
Right.
I know what to do and what not to do for the long term.
Got it.
Where do you see the field of dentistry heading in the next 10 years?
Oh, well, definitely going to be AI influence. I see people wearing goggles and seeing the procedure done on them in some way and seeing how they're going to look after the procedure's done. I see everything. I see AI really coming into dentistry and affecting us. I mean, it won't take over like some of the doctors can operate by remote control. I don't think that's going to happen. Dentistry is a very intimate affair and it's too precise and it's inside the mouth. But definitely technological advances in diagnosing. Yeah,
Wonderful.
that
Yeah.
that'll be where we're at.
Mhm.
So
I
we're
think so.
we're getting closer to the end of this conversation. So I would love to know a couple of do's and don'ts in dentistry. What would you recommend people not to do, or absolutely not to do, regarding
Well,
their oral health, and what definitely to do?
Well, to do is to come and see your dentist regularly. Obviously, look, I know that people are people, and they're going to eat candy. They're going to, do silly things. Don't bite on pen caps with your teeth, please.
Okay.
That's a major force. People eat candy. It's sticky candy that people don't realize that all candies have sugar in it, but it's the candy that's stickier. The stuff stays on your teeth longer, like gummy bears and things like that. Those are the worst kind because they stay longer. After you eat candy, rinse your mouth out. Just rinse it with water. Just rinse your mouth out, get rid of the sugars, which bacteria love to eat. They love sugars, do's and don'ts. Floss regularly. Getting people to floss, they don't realize that it just takes a couple of minutes.
Okay.
It takes me 1 minute to floss at night.
Wow.
That's it.
Good.
Just general, care. That's
Getting
all.
into the routine,
Yeah,
for sure.
get into routine. I can't go to sleep without flossing.
Right.
It's just the way it is.
It's a habit.
What is, yeah. So what is one key message you'd like to leave our listeners about dental health?
Well, dental health is so important. There's a lot of information out there now. People come in scared, saying, "Well, if I don't floss, is it going to cause heart disease and things like that?" You just have to take that with a grain of salt. Not everybody who comes in here and doesn't floss is going to get heart disease. But the bacteria that are on your teeth shouldn't be in your bloodstream. And if you floss regularly, that won't happen. So dentistry is one of those things where regular care can really prevent further problems. It's not like any kind of a disease or things like that. What you do is highly preventable.
Yeah, I think that's a very good line, that if you go to the dentist, you prevent so much. That is absolutely
Exactly. It's all preventable.
Yeah,
You just have to
absolutely.
come in, do a little bit of work at home, and you're good.
Yeah.
All right.
Wonderful.
So the final question is, where can we find information on you, especially in the New York City area, where
You can Google me.
Yeah, go ahead. Google
Yeah,
it?
Robert Fromm, FROMDDS. Go to Google. Yeah, we have good
Google.
reviews.
And so,
We have
and
nice
Dr.
reviews.
Fromm is the main dentist at Westside Family Dental Group. So you can go to westsideFamilyDental.com, and there you will find his bio, everything you want to know.
Plus,
Thank
our
you
practice
so much,
has
Dr.
over.
Fromm, for
Oh, you're
such
welcome.
great information. That
All
was
right.
great. Thank you.
That was a special simulcast of the Neil Haley Show and Celebrity Dentist. Take care, guys.